Everybody.
Hello.
Everybody. Hello. 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 Maybe this works. Maybe it doesn't. Thank you all for coming. The Human Services Committee. We and I think a number of people were all shocked by the decision of the Select Board to reduce to zero the allocation of any grants recommended by the RTM's Human Service Review Committee. We were charged by RTM to obtain applications from organizations who provide a variety of services to the townspeople of Brattleboro, and they had allocated a certain amount. Let me first, before I get too much further, acknowledge the Human Services Committee. We, as a group, worked. Our first meeting, I believe, was in June, and met every week from the beginning of October through the end of the year, and reviewing all the applications and coming up with final decisions. So my thanks to Alyssa Arroyo, Tom Oxholm, Avery Thompson, Zach Wiggum, who's not quite here yet, Sarah Turbo, and Robin Morgan, who will be joining via Zoom. We put together this forum to focus attention on the action of the Select Board. And for the past few weeks, the town has faced numerous concerns, as an observation, including extreme cold and major snowstorms. Each Select Board meeting seemed to have started with the Select Board acknowledging the work of the police, fire department, and public works to address those challenges, and all of which they did admirably. There was severe problems, and the town and these departments addressed them. But they also acknowledged the work of organizations that stepped forward to provide housing, food, and care. Yet the board does not wish to provide them any grants to help them to do what they do best. We have the opportunity as a community to address this situation in the coming months, either at the RTM meeting or open town meeting, dependent on the outcome of the vote on March 3rd. We appreciate the 8 organizations that are here this evening, stepping forward to talk about their programs and how our funding helps contribute to their success. We will run through a summary of the Human Services Committee activity since last March as a part of our agenda. After we hear from the organizations, we'll have a short video put together by Akil Savrasta. Then this video has community members who have been impacted by the organization supported by the Human Service allocations. After the video, we will have a Q&A session. We ask that all questions be addressed to the committee and not to individual organizations. So, on with the show. We can get, maybe, is the handle room open? If we need additional seats?
Yes.
So, Avery, can you bring up the agenda, please? And let's move to the timeline. So this is a timeline of activity since March 25th when the Human Services RTM voted to fund the F27 Human Service grants at an amount of equal to up to 2% of the F26 municipal budget. So that amount was $499,426. The discussion that took place at that meeting lasted, 45 minutes. It lasted for a while, talking about the amount of allocation that Human Services was going to use this year. From the floor, recommendations were to have no funding. Recommendations were to have half a percent, 1%, 1 1/4, 1 1/3, up to 2, over 2, and so it was quite in depth. And I think a lot of people spoke for what they wanted. A number of votes were taken, and it was finally settled on 2%. In June, the committee began to meet as we began to put together the application and the process and the timeline. With that, we modified our application process. One of the big changes is that we required each organization that was applying to provide us their annual 990. So with that, along with all of the other documents they include from the financial statement status, we came to understand well the abilities of each organization, the health of each organization, certainly the ability to them to meet and the needs as they define them. We received in October 23rd applications from 36 organizations, 1,475 pages of documents we all had to read and go through. So with that, what we did is we went through and we divided the we divided up equally amongst the committee various applications. Each committee member identified organizations that they had some sort of affiliation with and hence were recused from. They were not involved in that review process. Each member then presented to the committee what they read, and so we had discussions about each application. At this time, there was no decisions made on the application, but what we then did was, after all was said and done, each committee member then put through, using a rubric scored individually each application. We then weighed the average score, average being, in some cases, when no organization had any member who had to recuse themselves, their total score would be divided by 7, and if one person had to recuse themselves, it would be divided by 6. And then we went and sorted it by kind of the weight of from high to low. Actually, it was probably from low to high of the scores. We then went and began to talk about the amount of money they wanted, and made the decision and the allocation that we felt comfortable with. One thing that we found that was interesting was that the organizations in total represented 16,000 Brattleboro residents. Now, obviously, there's only 12,000 in town, and that means that there are a number of residents in town that have availed themselves of multiple organizations. And so I think that there is a demonstration of the value that these organizations provide. So by January 5th, after 27 hours of meetings, that doesn't account for all the reading they had to go through to read 1,475 pages. The committee finalized its recommendations for a total funding of $482,665. On January 13th, the select board began the budget review process that incorporated the human service funding. And despite the recommendation of what came through from RTM, they started with a budget with an amount for human services allocation of $250,000. There was discussion at that meeting that perhaps it would go before RTM, and that amount would be changed. And so, how would that weigh on the budget? Recommendations were to make it less, but they stuck with the $250,000. At the second meeting, they came out with, and immediately started with proposing that human services be zero. There was extended discussion about that. And finally, by a vote of 3-2, it was agreed that the human services allocation would be zero. I saw where you're sitting now, just stunned. That after 30 some years or more of the history of the town and its association and what it has provided and what it means, what it's come to mean to the town, that it would simply be reduced to zero. The final of the three meetings was on January 27th, where the select board voted to restore an article to the town meeting agenda so that the human service funding would be a separate article. And what that would mean is if the RTM or OTM were to change the zero, actually, although the article appears as $1, if it were to change and apply an amount, then the select board would have to accept that amount and go forward. As opposed to if it were included as part of the overall budget discussion, any change then would be simply a recommendation. The amount of $1 would be required, but the board need not follow the guidance of what RTM wanted to support. So going through with the article, adding the article to OTM or to RTM is important. And so that's something that will come up in later in March or April, depending upon which meeting we have. So that's where we are. And I've certainly, there's been a lot of discussion as to how much human services should have make available, how it should be applied, and so forth. And that now will be decided a little bit later. If in fact it does get changed, then my recommendation would be that the current committee take it upon ourselves to then reallocate the funds, as we are totally familiar with all the applications, and would be able to do that. I don't believe simply, if for instance it's cut in half, simply cutting in half everyone's application is proper. And I think that we would need to then take a look at it. I would recommend we take a look at it from a different perspective, and because it may weigh our final, decisions differently. So, with all that, if we could go to the presenter slide. That'd be number 3. The next one down. So we have these 8 organizations that have volunteered to come and talk about the program and talk about the benefit they provide to Brattleboro and benefit that we in turn provide to them. The order would be starting with interaction and then going to HCRS and then Turning Point, Women's Freedom Center, et cetera, down the line. So, interaction. If you introduce yourself, and then
Sure.
that would be great. Thank you very much.
Hello, I don't know how I got the honor of going first. Can you hear me okay? Hi folks, and apologies to the people I'm standing in front of. I'm Casey Beato. I am the Director of Restorative Justice Programs at Interaction. Before I start, I really want to thank the Human Services Review Committee. I understand the immense amount of work that you put in to review all these applications on top of your other obligations. So thank you really for doing all of this work for us. So if you are unaware of Interaction, you might actually be aware of us under our prior name, Youth Services. We rebranded a little over 2 years ago to Interaction. And we have 3 departments: the Restorative Justice Department, which I of course think is the best, youth programs, and a small but mighty clinical team. So municipal funding allows work to happen in our community by people who know our community. It allows us to quickly respond to referrals from police departments, schools, and courts. It allows us to support young people before behavior escalates. It allows us to reduce repeat involvement in the justice system. It allows us to be in partnership with other agencies, which you'll hear from tonight, and open dialogues with folks. It also allows us to do this at a fraction of the financial and social cost of deeper system involvement. I know that the work that we do can be difficult to really see, and sometimes that is by design to protect confidentiality. We can't always tell you about specific details of the youth that we work with and help them become renters in our town, or when we've brought tenants together to discuss issues with their landlords, or when we've supported someone to complete treatment at Valley Vista. But that is a drop in the bucket of the work we do. And we do it in concert with other nonprofits here tonight, as well as local law enforcement, the BRAT team, businesses, landlords, One Brattleboro, Situation Table, and as you can imagine, the list goes on and on. The work we do is outcome oriented, and we report data to the town, the state, and the federal government. Our youth programs team uses the Transition to Independence program model, which is a nationally certified evidence-based assessment tool. 20% of all misdemeanors in the state of Vermont over the past 3 years have been handled through restorative justice. And last year, our agency served over 600 residents of Brattleboro, which does not include the other folks, as we do serve all of Windham County. Resources like our town's human services funding allows the agency to respond to things outside of specific grant requirements. Grants fund programs, but they cap the amount that can be used towards operational costs. And if you look at our application, the funding we ask for goes towards our operational costs. This means that the infrastructure that allows the programs to exist, like having safe meeting spaces, the admin work to make sure accountability and compliance is there, and even keeping the lights on, is underfunded. We all know, I don't need to tell everyone, that the cost of living is rising, and Interaction is trying to retain our amazing staff through modest increases. But while these expenses increase, our grant funding levels do not. We all share a common goal of being good stewards of town funds. But as a nonprofit, we don't have a line item in our budget for absorbing the long-term cost of unmet needs. When our young people don't have access to the case management we can provide, when harm isn't addressed, and when people don't receive the support they need to build resilience, those costs don't just disappear. They simply shift, and often they shift back to the town in more expensive ways. And similarly to us, the town does not have a budget category for increase in police calls or long-term instability. That's why prevention and early intervention are not just compassionate choices, but fiscally responsible. In closing, community members have the capacity to come together and solve community issues. The people that are dedicating themselves to these issues are local. Municipal investment sends a message that this community believes in accountability and also in growth. It says we want responses to community needs that are thoughtful, effective, and rooted here at home. Thank you.
Thank you. You want to try that, Hannah?
We have all these helpers here. I thought somebody would want to grab chairs. Right. Thank you.
Okay. My name is George Karabatakis. I'm the CEO of HCRS. And first of all, it's remarkable to me. What do you say, 154,000? Just thousands of pages.
War and Peace.
What's that?
War and Peace.
I really want to thank you for all the work that you've done. And I certainly want to thank the town for the support that we have received over the years. And so HCR, we are the designated community mental health agency serving Wyndham and Windsor counties. We serve well over 4,000 people. In our catchment area, we serve 867 people, 867 individuals here in Brattleboro, and have provided over 73,000 hours of services to those folks. What we do is essentially we're providing mental health, substance use, and developmental disability services to adults, children, youth, and families, and folks throughout our community who are in need, who are struggling with trauma, with depression, with a whole range of challenging issues that impact their lives, poverty and homelessness and food insecurity and all the other challenges that they face. We know that in order to do the work that we do, we have to collaborate. We have our police liaisons that work with the police department and the BRAT team and the town of Brattleboro. We have folks that support the hospital, BMH, Winston Prouty, Interaction, Groundworks, the Drop-In Center, DCF, Probation and Parole, and housing providers, Brattleboro Housing Partnership, and so many others to support them in succeeding in our community and to really address the issues that they come to us with. And the funding that we've been asking for is to support our access navigation program and to support coordination that helps people connect to the really important services that we provide and all the partnerships and collaborations that we participate in. And so it really makes a difference in people's lives. And I should also mention that another one of our programs that we're really proud of is Kindle Farm, which is a therapeutic school in Townsend, Newfane, which also supports many of our kids and many students. And of course, we have some collaborations with schools, so we have staff that are co-located or embedded in schools as well. So I just want to put it out there that the services we provide are not just for people the people that walk through the door, they are our neighbors, they are friends, they are family members. They may be one of us going to really get the help that we need to really succeed, and having a place to get that support, to get whether it's therapy or case management or services in the home, crisis services, mobile crisis support. Those are the services that can help people get through to the point where they can move forward and really find a way. And so that's what we're asking for. And I don't know if I'm okay on time.
You're doing fine.
Okay. So I just wanted to thank you for all your support, and that's it. Thanks.
Yeah, good job.
I'm Elias Burgess. I'm the Director of Turning Point of Whitman County, located in downtown Brattleboro. We are a nonprofit peer support recovery center. We are not clinical. We are an organization of folks who have a personal connection to addiction and recovery, trying to use that experience to benefit our community as a whole, and specifically those of us in our community that are also struggling with those same issues. I did not prepare any remarks today, and I'm not realizing I probably should have, so you'll have to forgive me for speaking extemporaneously. But we have served as a community center in downtown Brattleboro for years now. We kind of expanded operations in that field throughout the pandemic, especially when there were so few places open that people could come in and just have a warm place to be and have a conversation with a friendly staff member. Access to further services if that's what they were looking for. We are embedded in the community and in the human services community in general in dozens of different ways. We work with the BRAT team. We do outreach coaching at something like 14 different locations every week, including the Comprehensive Treatment Center, various supportive housing locations, encampments, all of that. We work with Brattleboro Memorial Hospital and Grace Cottage Hospital, providing peer support in the emergency departments. That's how I got my start, so the program is near and dear to my heart. Through that program, we meet something like 150 unique individuals who have just experienced an overdose or drunk driving or have just come into the emergency department specifically asking, like, I think I need help, what's the next step? And we're the first people they call. We also do a number of creative collaborations. We try to expand the horizons for folks who have, by necessity and circumstance, often found themselves in very kind of boxed-in, limited lifestyles. So we offer, classes in collaboration with local organizations like Hatchspace to do woodworking, or Bonneville Environmental Education Center to do nature survival classes. Really just trying to build community and get people out in the world and active and in a position to start building their own lives. The reason the human services funding from the town has been so essential to us is that the nature of our work means that our funding almost entirely comes from state and federal sources. We do have extremely generous donors, which I cannot thank them enough, but proportionally that represents a pretty small fraction of our budget. And the grant funding that we receive is extremely specific and extremely limited in what it can be spent on. Something like 85% of our overall operating budget goes directly towards payroll. And on top of that, we have staff trainings, we have the mortgage, all of that stuff, which leaves us with just a real sliver of unrestricted funding that can be spent on just daily necessities or anything that falls outside of that very limited list that is provided for us by the state. And the human services funding from the town has traditionally been one of the things we've relied upon to meet those needs. Like, if the toilet downstairs is clogged, we need to call a plumber. That's not something we can charge our grants for, so that has to come out of our restricted funding. And that is something that has a cumulative strain on a center that's operating 5 weekdays, but also on weekends to serve hospitals. So, as others have said, not to be a broken record, but I can't say enough how much I appreciate the Human Services Committee and the town for the support that they've shown us. And I don't have a mute button to put on this, but thank you so much for your time.
Thank you.
Thank you.
Hi, I'm Tracy Sloan, board of the Women's Freedom Center, and thank you for the opportunity to speak tonight. It's very important work. And for more than 50 years, the Women's Freedom Center has been here for this community, in moments of crisis, in moments of fear, and in moments when someone has decided they cannot endure abuse one more day. Domestic violence, sexual violence, and human trafficking do not happen somewhere else. They happen here. They affect our neighbors, our coworkers, our children's classmates. Violence does not discriminate, and neither do we. Last year alone, we supported 242 Brattleboro residents, with services including 24-hour crisis response, emergency shelter, legal advocacy, hospital accompaniment, counseling, prevention education, and assistance with housing and basic needs. 38 residents needed emergency shelter because where they were staying was no longer safe. These are not just numbers. These are families forced to make impossible decisions. Those are children who needed safety that night. Those are people who found the courage to ask for help. And when they did, we were there. We answer a 24-hour hotline every single day of the year. When someone calls in the middle of the night, terrified and unsure, a trained advocate answers. That call can mean the difference between isolation and connection, between danger and safety. Our shelter is more than a building. It is a safe haven for someone who may have left with only the clothes they were wearing. It is a place where a parent can finally sleep without fear. It is where children can begin to feel secure again. We provide legal advocacy, help navigating protective orders, support at court hearings, emergency financial assistance, and ongoing case management. Survivors must often navigate complex systems while carrying deep trauma. We walk beside them for as long as it takes. We are also committed to prevention. In our schools and workplaces, we teach about healthy relationships, boundaries, and consent. The safest community is one that works to prevent violence before it starts. Town funding is not symbolic, it is foundational and transformational. Grants fluctuate, federal and state priorities shift, but local support sends a clear message. This town stands with survivors. That safety is not optional, that we take responsibility for one another. When survivors receive timely support, that benefit ripples outward. Children are more stable, housing crises are reduced, emergency services are more effectively used. Long-term human and financial costs are prevented. If these services shrink, the violence does not stop. The need does not go away. The only difference is that survivor faces it alone. By supporting the Women's Freedom Center, you are choosing a safer town, a more stable town, a town that refuses to look away. Thank you for your continued support to not only the Women's Freedom Center, but to our community and to the people within it who need it the most. Thank you very much for your time.
Thank you.
There's a chair over here, if you'd like to sit. Boys and Girls Club.
Hi, I'm Lisa Ford, the board chair of the Boys and Girls Club, and I somehow forgot my reading glasses at home, so I had something prepared, but I'm going to kind of wing it or squint while I'm trying to read it. Oh,
Yeah.
okay, thank you. A little stronger, but yeah, that's great. Okay.
They look great on you.
It takes a village. All right. It was great. So again, like everyone else, I want to thank the Human Services Committee for all your work. I really appreciate the applications that are evidence-based and data-based. You know, that's very time-consuming to read and collect all the information, and I really appreciate that you do that. So thank you again and for giving us this opportunity to come and talk about the impact we make in this community. We're a 26-year-old mission-driven organization that strives to enable all young people, especially those who need us the most, so everyone and people who need us the most, to reach their full potential as productive, caring, responsible citizens. With an operating budget just under $1 million, we actually do a lot and we're very efficient with our money. So we serve over 700 young people a year from the ages from 5 to 18. We employ 16 youth development professionals and administrative staff. We operate multiple sites year-round. These program sites include our downtown Teen Street Center on Flat Street and our 2 state-licensed after-school programs for elementary age students. One is located at the Retreat Farm, and one we just recently opened in September at the Westminster Central School. Really happy about that. We're proud at the fact that we actually own, as of last year, officially own our 8,000 square foot building on Flat Street. And in addition, we also, with an indoor skate park, just want to add that. So we also own 3 vans, which we use to transport students door to door from Brattleboro schools to our program sites. So if anyone owns 1 car, you know what it's like to own 3. We're licensed, while our licensed after-school programs and summer camps are tuition-based, most of our families do receive some amount of subsidy or scholarships. We never turn anyone away for lack of funds. At the same time, our teen center on Flat Street provides free programming 5 days a week and solely relies on unpredictable revenue, such as grants, foundations, and private donations. With help from community partnerships, we're able to provide unique enrichment programs such as cooking classes, woodworking, workshops, career camps, theater programs, technology classes. As you know, so many of these programs are sometimes out of reach for many children, but we provide a lot of these programs for free, because of some of the funding sources that we have. We've taken kids on college tours and we have college counselors, so really those have impacted a lot of students. So our staff and board want the community to know that we deeply appreciate the Human Services grant we regularly receive from the town. It definitely helps offset our costs to serve children. However, we also do recognize that there's a financial strain being felt by the town and by our neighbors. We understand the municipality's need to evaluate the impact of the Human Services funding on our taxpayers. Many of those taxpayers are families that we serve and people we really care about, our donors and families. Therefore, our board has really kind of decided to remain neutral on this issue. We just really respect any decision made regarding these funds, and we'll plan accordingly in our budget. We really appreciate all the support we've received. We understand that times are changing and sometimes funding changes. And that's all I have to say. We appreciate everything you do.
Thank you.
Sure.
Senior Solutions. Oh, no, we went there. I'm sorry. Roundhouse.
Hi there. Thank you for the opportunity to speak here tonight and for all of the work that you do. My name is Libby Bennett. I'm a Brattleboro taxpayer and I'm the Executive Director of Brownhouse Collaborative. We, the residents of Brattleboro, like so many communities here in Vermont and around the nation, are faced with hard questions, decisions, and impacts that we will directly feel as we pass our town budget for FY27. Our neighbors experiencing homelessness and hunger feel the impacts of these decisions every single day. We're not alone in this destabilizing moment. Instability keeps our community in emergency response. We need stability to turn the dial on these challenges, and removing human services funding from the town's budget would drive us and our many partner agencies further from achieving that stability and from building a stronger community for us all. This year, Groundworks and so many of our community's human services agencies are faced with more funding uncertainty than ever before. 64% of Groundworks' current year budget relies on income from state, federal, and local government grants. Every year, we must raise the remainder of funds not only to cover our costs, but to leverage support from state and federal sources, so many of which are uncertain for next year. Brattleboro and other local municipalities' human services contributions, alongside every dollar we raise from individual donors, allows us to plug the holes left by insufficient state and federal funds that we use to provide services to our neighbors. Groundworks Collaborative operates 8 distinct programs: FoodWorks, the Drop-In Center and Overnight Shelter on South Main Street, the Outreach Team operating throughout Brattleboro proper, and housing case management support, including for the HealthWorks Act team, and the list goes on. Not a single one of our programs breaks even or has long-term stability from state and federal support to meet our ever-rising expenses. Groundworks employs nearly 50 staff needed to provide services to over 5,000 of our neighbors each year, of whom 72% of the people we served last year are Brattleboro residents. That's 3,609 residents of Brattleboro who needed our help to meet their most basic needs. Many of our neighboring towns ask in this process what percentage of our budget was spent serving residents of their town. Groundworks spent $2.8 million, 72% of our budget, serving 3,609 Brattleboro residents last year. That means roughly 1 in 3 Brattleboro residents received services from Groundworks Collaborative in FY25. Homelessness proliferates in areas of this nation where housing is scarce and especially expensive. Like communities all over America, our neighbors have been priced out of housing in a county that has the most short-term rentals and among the highest rate of second homes in the state. At the same time, we live in the oldest county in Vermont, a demographic we see every day in our work, with data from 2020 to 2025 demonstrating a significant and concerning 133% increase in adults aged 55 and older, utilizing Groundworks Drop-In Center and Overnight Shelter services. Our outreach team has found the same to be true. They served 74 individuals in 2025 living unsheltered within the town of Brattleboro. Wages and fixed incomes cannot keep up with our housing market any more than they can keep up with the cost to feed a family, to keep heating fuel in the tank, or to pick up vital prescription medications. State and federal policy choices made over decades have created these challenges, leaving people in situations that range from precarious to struggling for survival in this very community we all call home. At Groundworks, we're on pace to open 40 additional beds and services this coming fall to offer stability for our neighbors during their long wait for sustainable housing. As a result, we will go into next winter with a total of 74 beds for our neighbors who would otherwise be unsheltered. While we may be ill-equipped to fully fund all of these many needs, I argue that we should not be contributors to the instability facing this community. At Groundworks, we envision a community where everyone has enough food to eat and a place to call home. We know that we won't be able to solve the big systemic crises of our nation here in our community in FY27, but we know that we can make daily impact for Brattleboro residents who need our services. And we need the town of Brattleboro to stay with us in this work. Thank you, and thank you to the Human Services Committee for all your work.
Thank you. And last but not least, Putney.
Hi, David. This is Sarah Turbo. I just want to say that Kevin Golden is on Zoom and is ready to speak after Hannah is.
Okay.
Thanks.
Hi, I'm Hannah Pick. I'm the director of the Putney Food Shelf. And just to clarify right off the bat, Putney Food Shelf does serve Brattleboro, sorry. It serves all the surrounding towns. We consider it part of our core service area along with Dummerston, Westminster, and Putney. So to echo what Libby was just saying, at this time where affordability issues are a nationwide problem, it's also a problem here at home. And from my perspective, and the perspective of the Putney Food Shelf, it's a time to invest in the local support system. We have a very strong support system, which has all been spoken to tonight, which is remarkable, and so many people benefit from it. Over the past 6 years, we have seen at the Putney Food Shelf a 280% increase in need for food. This is a trend that is echoed beyond Putney Food Shelf. It's statewide and it's beyond that as well. In moments of crisis, the Putney Food Shelf can step up if we have the resources that we need. An example of this was this fall when the SNAP benefits were frozen during the government shutdown. We were aware that 3,600 households in Windham County rely on SNAP benefits, and without those benefits going out for the month, that was a real crisis that we needed to step up to fill the gap, and that's what we were able to do. The Putney Food Shelf is serving, so 30% of the shoppers that come to the Putney Food Shelf are from Brattleboro. 30% is the same amount of people that we serve from Putney. So it's a very significant amount of people, and that's why we come to Brattleboro to request funds. Last year, we saw over 2,500 visits from Brattleboro residents, and 177 households shopped for the first time. That's a 17% increase from the previous year, and again, 280% increase overall in the past 6 years. That's a lot for a small organization to adjust to. It's been a lot of rapid growth. We see many large families coming from Brattleboro as well as seniors. And I believe that that's because, especially for large families, they are seeking more food than they can find in a single shop at other places in Brattleboro. Putney Food Shelf offers also a weekly available shopping trip, and people can shop for friends and neighbors. We are seeking funds from all towns in our core service area, and we are asking for a proportionate amount from each town. So we are requesting $20,000 from Brattleboro, $20,000 from Putney, $5,000 from Westminster, and $3,000 from Dummerston this year. It's all an equitable ask, and we really hope that Brattleboro will step up to be part of this fair share of support that makes our work possible. When all the towns pitch in, it collectively creates a foundational piece of our income that is important. It's only one piece, as all nonprofits have to find many sources of funds. We're in the same boat. So what do your tax dollars provide? At the Food Shelf, shoppers find a wide variety of fresh produce, dairy, meat, eggs, dry goods, some personal care products, along with dietary and culturally specific foods that meet the needs of the neighbors around this area. This is a low barrier food pantry offering free choice, much like a small grocery store. And people, as I said before, are welcome to shop weekly and shop for friends and neighbors. Excuse me, we really hope that you will consider the value of having available food at the ready for your residents so that people in Brattleboro do not need to go hungry. We're there for you. And we ask for the support to come back, to make it possible to continue that level of service. Thank you.
Thank you. Thank you. And then Avery, Sarah mentioned somebody else wanted to.
introduce Kevin Golden. Is that right?
Yep, I just unmuted Kevin.
Oh, great.
Try that again.
I may have not done what you just did.
Thank you, Sarah. I appreciate it. Good evening.
Kevin, do you want to see if you can turn your video on?
Yes, give me just 1 second. It says I cannot do it. It's disabled by the host.
That's okay. We'll just have to hear your glorious voice.
It might work. Try it again.
Thank you. Well, good evening. My name is Kevin Golden, and I'm with Senior Solutions. And thank you for the opportunity to speak. First, I'd like to express my deep appreciation for the work that the Human Services Committee has done on behalf of nonprofits that serve Brattleboro. And I know that the Human Services application is thorough and detailed, and I appreciate the level of energy and thoughtful care that goes into designing it, let alone reviewing all of the many applications and making thoughtful recommendations. Senior Solutions exists to promote the well-being and dignity that every person should be able to age in the place of their choice with the support that they need and opportunities for meaningful relationships and active engagement in their community. And here in Brattleboro, that's something that's happening every day. Last year alone, more than 800 borough residents received a service from Senior Solutions. Our helpline handled more than 900 calls or office visits from Brattleboro residents, helping people navigate housing, benefits, transportation, and care options. We provided more than 190 Medicare counseling sessions, saving residents money and helping them understand the complex coverage decisions that they had to make. Through caregiver support and grant assistance, we help families continue caring for loved ones at home rather than facing institutionalized care. Our in-home case management program last year served more than 150 residents and provided more than 2,700 hours of direct support, helping them remain safely in their own homes. Our volunteers made visits, ran errands, and checked in by phone on isolated neighbors, contributing more than 2,300 hours of companionship and practical help. And through partnerships with Brattleboro Senior Meals and community meal sites, more than 180 residents received over 30,000 meals. And altogether, these services represent more than $500,000 worth of assistance provided at no charge to Brattleboro residents. At the same time, that need is growing. 2 years ago, the state of Vermont directed that all Medicaid choices for care and moderate needs group case management clients in southeastern Vermont be transferred from the Visiting Nurses Association to Senior Solutions. And we are now the sole provider for all of those referrals. And we're already seeing the impact. In 2024, our case managers served just over 1,600 hours of case management. And last year, that grew to 2,700 hours of case management, and the numbers are continuing to rise. And compounding this is years of flattened funding from state and federal governments, and it's put many nonprofits in an increasingly difficult financial position. And this coupled with recent federal disruptions and delayed funding streams has created uncertainty for programs that we know Brattleboro residents depend on: meals, benefits counseling, caregiver support, and in-home case management. These are not optional services. They are the difference between someone staying safely in their home and entering a nursing facility sooner than they need to, or becoming unhoused. It's the difference between stability and crisis. And that's why appropriations from the town of Brattleboro matter so much to us. The $20,000 appropriation that we requested is a stabilizing investment in the lives of older adults in Brattleboro. It ensures that older residents can continue receiving essential support without interruption. It helps families care for loved ones locally. It helps neighbors stay connected, nourished, and safe. And it allows us to leverage hundreds of thousands of dollars in state, federal, volunteer, and community resources directly for the people of your town. In short, this is a local investment from Brattleboro's budget, and it protects over $500,000 in services and allows older adults in Brattleboro to live with dignity, independence, and connection to their community. And so on behalf of the residents we serve, and those are your neighbors and ours, and all of the staff that work at Senior Solutions, I just want to thank you again for your consideration and for the continued support of the Human Services Committee.
Thank you. Thank you. Thank you. So that is the organizations that came to speak tonight, and I want to thank each and every one of them for coming. for sharing information about your community.
Getting a note from Zoom, we just need to speak closely with Mike unless we get turned up over there. Sorry, it's like 3 different people said at this point, so I want to make sure they can hear us.
So anyway, I want
Thank you.
Got one more presentation that wants to speak. I'm from SEPCA, I'd love to talk.
Oh, sure. Please. Thank
If you
you.
don't mind.
No, thank you.
Hey, I'm John Mendes Russell from SEPCA. I work up in Westminster. I'm a Brattleboro taxpayer and work in development and communication. And it's hard not to say a lot more as a taxpayer, but I think I'm just going to read a couple stats here and make one point about what we're all doing here. We helped 446 households, 854 people. Around $440,000 were spent on services in this town. People had their taxes done, their houses had fuel in them, among many other things. And I think what we have in this room are needs. I think there's a lot of things in the budget I looked at earlier that are wants. And I think we have to make sure people have basic necessities. Everybody in this room is proving a pretty good point, and all I'll just say is, let's just pass this budget so we can get some money so people can live simply and safe and warm.
Are there any other organizations? But thank you for each of you for coming, and certainly for all that you do for the residents of Brattleboro. One final Tom, you want to give one final comment on the process and what we went through?
Sure. David asked me to comment on the process, but first I just want to thank you all for being here, for your patience, for what you do for our neighbors and friends. It means a lot. I've lived in Windham County for 25 years, the last 9 in Brattleboro, and I've always been impressed with the commitment to human services. I think it's one of the hallmarks of this town. I'm a career nonprofit fundraiser, so I understand that really well. Last year at town meeting, I was surprised at the level of animosity, I guess, expressed towards this funding and why we need it as a town. And so I volunteered to join the Human Services Committee for the first time. And not knowing exactly what I was going to get into, but it's been a very eye-opening experience for me in the positive. You ask anyone on the committee, I'm the one who asks a lot of questions about finances, about process, procedure. I think it was a very thorough process on our end. Not that it wasn't before, but any concern that I had about the need for this funding in this town and the process by which the committee arrived on the decisions and the validity of all the charities involved really remained very clear to me in the process. So as someone who was an outsider before, but was very much involved in this year, I can, you don't know me necessarily, but it was a process that I feel very, very good about in terms of doing our due diligence. The due diligence that you all did as organizations seeking funding. It meant a lot to me that this community is that committed to this kind of program. And it even surprised me more when the select board zeroed it out, because it's basically like saying the town doesn't care about human services anymore, which I know is not true. So thank you, David.
So, Q&A time. Well, okay, hang on for one moment, please. Q&A time. As I stated at the beginning, all questions should be directed to the committee. And we're not here to pose direct questions to any of the organizations that either were here tonight, represented tonight, or were included on the Human Service Committee's allocation list. So, with that, questions?
First Pride District 9 rep. First of all, I want to thank you guys for your hard work. I remember the day before the Human Services Committee, not to be a broken record, but it was a ridiculous process that took a long time. What you guys have done over the years has made the process more fair, more relevant, more useful, and saved us a absurd amount of time on the smallest part of the budget. The other more recent historical reference is to anybody who claims that, including apparently the select board, that the town does not support this to the degree that we have. The electorate at large does not support it relative to the level that the representative town meeting set the amount at. Was proven untrue by the vote, the non-binding referendum vote on human services level of funding. And the weighted average was pretty much exactly where we landed as an RTM. So I'd like to put in a plug for RTM here. Anybody who is concerned about whether it really does represent the town, talk to your local RTM members. They're all accessible, reachable by phone or email on the town website. We're all available. Thank you.
Gary?
I didn't get up. 62 this February. Thanks for the human
You're
services.
a youngster.
Yeah, pretty bold. I just wanted to say that I was on Human Services Committee way back for years and seeing how it grown and the changes it took after COVID and how it helped out. But I just didn't do that. I also went and volunteered myself at these agencies so I can get a better understanding. Anything I invested, I want to know what it's about. What am I doing here? So to better understand before passing judgment and saying, well, this is, have you ever volunteered, have you ever gotten involved? Have you been a part of? Because the key word is human service, and that's something that we do already. Be it a family member or at work, we are as a community have that unification to go out there and help our fellow brothers and sisters, whoever is coming in, new and old, to say that we've forgotten how to do that and not continue to do it. Because I can tell you one thing, poverty doesn't discriminate. Anything in life that comes, especially what's going on now, today's climate, in Washington, there's no guarantees. You're gonna wish you had human service being cut. I promise you something, I said this at RTM, there's gonna be a family member, or if you haven't, you will be using this agency, or you have been, or you will be. At some particular point, any of these agencies that are there, to eliminate it, and if it's gone, there's no taking backs. Once it's gone, that's it. So you have to really take a step back and you gotta really look in your hearts and in your souls and say, if that was me, what would I want to do to help my fellow brothers and sisters? Anyone coming into this town to do the right thing, humanly possible, that's an adequate service. So to me, doing this and volunteering and donating and helping out these services is my reasonable service. I shouldn't even have to. That's something that you do already in your homes, in your life. You see somebody in the street, can I help you carry them? That's a human service. So there's no reason to debate this, to know to do the right thing and to do it. It's a thing that you should be doing. You shouldn't have to think about it or talk about it in committee. Thank you.
Thank you.
Ken?
Ken Fay, District 8 RTM member. I'm a big fan of the human services. I think it's a great system. I'm just curious as to the determination of who spoke tonight. Was there a rubric or a matrix or on that?
What we did is we sent out word to everybody that we were putting together,
And these groups said that they were, I'm sorry.
We sent out information about the forum to all the organizations that applied, and it was this group that wanted to speak.
Okay.
Edie?
I'm Andy Davis. Lived in town since the 80s, been a long-time RTM member for District 9. I think we've got a kind of a perfect storm going on in Brattleboro. The select board, I think, was in love with the number 6.2% increase on the budget and didn't really have the backbone to add 2% to that and follow the recommendation of RTM last year. They wanted to put the target on the back of RTM. We have a lot of candidates for select board who are advocating publicly to get rid of RTM, and RTM is being, I think, scapegoated for this small part of the budget. I feel bad. You all have done your work. Historically, Sprite is completely right. Before the Human Services Committee, we got tangled up in discussing individual grants to individual organizations, and we created, I don't remember what year it was, this committee, and put a lot of faith and trust in it to take a dollar amount that was in the budget as presented by the select board, and how do you divvy that up in a way that's fair and effective for the town. Starting in 2018, and I went back through a number of the budgets, RTM started perceiving that there were unmet needs and began to push upwards on the human services allocation. But it's always been kept as this separate responsibility on the warrant, that RTM votes separately on this item. I believe that I could go on the history, but I'm not going to. I want to get back to where we are now and how we get human service funding on a more solid foundation. I was told for years that human service funding had to be a separate article, but it turns out it does not. There are towns in Vermont who give to certain local organizations year after year, and they put that amount of money in the town budget. It's part of the operating budget. And we have a number of organizations in this town that do the work. If the Brattleboro government had the manpower to have a Department of Human Services, these organizations would be doing the work that the town would do if it had the employees and the budget to do it. And it should be fused to our operating budget to take care of basic needs. And I think that that's where we need to go. We need to have a kind of a roundtable and determine which services are absolutely essential, to cut them out. And I notice, I hope I'm not wrong, but I don't see any select board members here tonight. I hope they're all at home into their computer screen. One, thank you. One, I was looking around. That's because she's so humble. Okay. But the thing is that I remember when that decision was made to go to zero, the next thing expressed by the select board is, where's the next cut? That was the next words that were said. The select board is interested in the tax number. We need to get, for us to cut out human services is the proverbial cut off the nose to spite the face. All of these organizations put more into our community than 2% of our budget of the town, way more. But there are some organizations that have multi-million-dollar budgets and ask for what really come out to be tiny amounts of money. And I've heard that they leverage that. It's good to have municipal support when you're writing larger grants, and I understand that. But I think we need to build human services into the town budget. And otherwise, we're just pulling the rug out from ourselves. All of these organizations are providing essential services to this community, but at the same time, a municipal budget cannot politically fund everything and every project. I think it needs to be focused on things that are widely perceived as essential human services and rally around those basic human needs, build it into the town budget, and find the political support for it. Have select board members run on raising human services and not foist it off on RTM and then work to abolish RTM. Thank you.
Thanks for your statement. I will, if there was a question in there, I would just like to address.
There was no question.
Okay, well, I could respond to a key point that was, you mentioned how there are tiny amounts of money in the larger budgets that are asked for in this. And what was notable this year, I've been on the committee for 5 years now, and it's amazing to see just the breadth of work and the ways that you all collaborate with each other. It's incredible, the organizations here, but also in other places. And this year, we actually had a lot of people who didn't reapply. Maybe because it's been contentious, I don't want to speculate, but so we're actually seeing that a lot less. Like it used to be for years, there were people who would get, for example, ask for $700. There was one organization that always asked for $700, and they tied that to something really specific. And another that asked for about $2,000 that was very local, and they didn't reapply. So we might be seeing that kind of leveraging a lot less because of the way this process has been going. And we've also been really diligent, especially, with our members and everything too, talking about this a lot with whether or not there's a need. We actually look very deeply. We spend a lot of time on the budget documents actually. So I know we ask for substantial budget documents. As somebody who's worked in nonprofits, this is one of the most arduous applications that I had to do. And I did, before I was on this committee and I worked in this fundraising. So it's amazing, like just credit to you all for filling all that out for amounts of money that actually aren't as high as some places that don't have as many
clarify
questions.
one thing you might?
Sure, yeah. And that wasn't just to pick on your question. I just wanted to because we talked about RTM and that was an
That's why I
update.
think there really needs to be a round table and get more voices, because I think the function that you all do, and you've done your work, you all deserve a round of applause. You've done what you were asked to do, and you've done really well. It isn't about you, it's about where is the underpinning support. And the public, who I think is struggling with the tax level and the tax increases. Last year we had a double-digit tax increase. They are looking at it. I know of a couple of organizations that have budgets over $50 million that are asking for very tiny grants. And I just wonder what that's about. I know one of those, I know that some organizations have even withdrawn their request in the current climate. But I think there needs to be a wider roundtable that's more than the Human Services Committee to look at the policy and find a policy that is politically supportable. The work that you guys are doing is fantastic, but the mission has changed because of the pressures financially, and the big elephant in the room is how Brattleboro is thinking of changing the way it makes decisions. And without a town meeting, I'm very fearful of the future of human service funding in the town of Brattleboro without a town meeting.
Thank you.
Nope.
Nice try. Good save. And we are getting a little close to time, right? So, but are there any more questions?
No, we plenty of time. Anybody on Zoom?
Okay, go Zoom.
Bill Harvey, District 8, AG. I think it might be a breath of fresh air to give a report from somebody who has received the benefit of Health and Human Services. I believe we have an adult learning center here in town that's supported by you folks, am I right?
Mm-hmm.
Absolutely. And I want to tell you, it's a fantastic organization. It is almost unbelievable. I went up there because I thought, well, why not take a chance? I need to learn more about how to run a computer. I think there's a lot of people in my age bracket who may have difficulty with the computer from time to time. I went in there and I was just overwhelmed. I kept trying to figure out how I was going to pay for this thing. You know, I kept trying to figure out, well, where's the bill coming from? And I couldn't believe it. There's no bill. So I definitely wanted to donate towards it. They did a fabulous job. But we have an organization here in Brattleboro that can educate people freely. I mean, it's within walking distance. It's when you can take your bicycle there, you can get a bus and go there, and you can get an education so that you can better yourself and get a better job. And I think it's one of the organizations. They didn't ask me to stand up tonight. I hope I'm speaking well for them. I just want to say they do a fabulous job, and there are health and human services in the town of Brattleboro that have really made our community a better place to live and taken a person from perhaps underprivileged, perhaps a situation where it was beyond their control, and giving them a chance to move up in society and become a supporter of our community. So hats off to you guys. I think you're doing a fabulous job.
I just want to name, you all keep thanking us, but you're all, a lot of people I'm seeing in the room too are people who are at RTM or also just Brattleboro voters who live and work here. So yeah, thank you for being part of these organizations, but also part of our economy and our taxpayers. I think that's a thing that often gets lost, is that we also are, this is our economy too. So it's the services that we provide, but a lot of these organizations are based here and are hiring our friends and neighbors and each other. So that's something we've thought about as a person. I do see a hand.
Okay.
Ready, unless there's anything else. Okay, great.
Good evening, everyone. First of all, I just want to let you know that the audio quality coming from the room is so poor that all of your voices are barely intelligible. The voices of people who are coming in through Zoom are coming through crystal clear to me. So that indicates to me that there's something wrong with the audio interface in the room to the computer host. Having said that, the major question that I have is that I'm looking at the RTM Human Services Committee page on the town website, and I'm not actually seeing any applications from any of the individual organizations. And I'm wondering if those are available to the public, and if they are, where they are, and if not, why, because these are public proceedings, and this should be part of the public record. Thank you.
We have not posted those. Much of the information that is provided, goes beyond 990 and gets into some of the corporate philosophies and background. I've asked the question actually of town council. I have not had a response as yet. But no, we have not posted them on the website.
I just wanted to add, David, to what you responded, that we did discuss this in the committee at the beginning of our process about should the applications be posted publicly, and some feedback that we had gotten last year about that from applying orgs was that there was two concerns that were raised about doing that. One of them was that some of the folks include testimonials in their application that, even though they're anonymous, they might have identifying details that could make the threaten the anonymity, I guess, of people who wanted to share about their experiences using these services. And then the other concern was just about the sort of intellectual property of these grant applications, because it is such an extensive project of writing these, that some orgs that had trouble with people like plagiarizing from their applications were concerned about having that posted publicly. So those were some of the considerations that we talked about when we decided to continue not posting the applications themselves.
favor of it. And I'll also add to that. A third thing is we talked about this extensively because we thought about that, and we do like the idea. I mean, I, as a committee member, always want to get everyone to read them, because if you read them, you'd see why this is so powerful, and you'd see why we're wanting to fund it. And so we wanted people to see that, but we knew that there were issues with these applications and privacy and things like that. I mean, as some people have spoken to tonight, there is some really sensitive information about potentially our neighbors in these, including children, including survivors. And so what we did was we publicized when we were going to talk as a committee about each application so that people could come to the open meeting. I mean, full disclosure, no one seems to want to come to the meetings, but we tried. So thank you all for coming tonight. Like, we offered you to speak, so you came. But in general, you could come. So what we did was we actually shared the application on the screen so you could see it, and we scrolled through, and we left time for the committee and the public to ask questions about each organization. And a lot of the meetings were like, somewhere between 3 to 6 applications in a night. And we did that over the months. And again, like, occasionally people came. I recognize at least one person who did, but in general, people didn't. So we weren't going to post them so people could do whatever they wanted, but they could see it. They could ask questions. They could make us scroll to a section. So we were able to do that. They just wouldn't be able to hold that information. And we thought that that would be a compromise, hopefully. So that's what we did this year. And we can still debate about that as a group, but yeah. Were there any more questions in the room or on Zoom?
Hey there, let's see. Does that sound okay on Zoom, or?
It might be from the computer, unfortunately.
Okay.
But
Well,
try
at any rate, so I'm John Keene. I'm the board president at Turning Point, and I actually wasn't necessarily planning on speaking tonight. Although a couple of things that encouraged me. Number one, that restorative justice is in the room, and I am actually a byproduct of the restorative justice program. That's actually how I got involved with Turning Point in the first place. So as sort of an example of one of the 16,000 some odd people who double dipped or what have you, here I am. So a couple of things to just sort of piggyback on what we've been talking about in terms of transparency. I would like to encourage anyone who would be interested in, say, coming to a Turning Point meeting or a board meeting, that those board meetings are open to the public. They happen the second Tuesday of every month. Please come. We would love to have you there. On top of that, 990 forms are a matter of public record. As somebody whose professional life is actually in the fundraising realm, I can say that oftentimes those can be a little bit hard to find because the way that they're published oftentimes trails far behind when they've actually been submitted. So I'm seeing, some winces there of recognition. But yeah, our books are totally open. So to the extent that it would be helpful to people to, come in and, check things out, please do. I might as well just make one more observation while I'm up here, and then I'll pivot this into a question. I did notice, throughout the course of this evening that a number of the organizations have pointed out that they work with the BRAT team. And this is something, and I guess I should say as well, I'm speaking on behalf of myself. This is not the board of Turning Point's opinion or whatever. But I have certainly noticed recently in sort of the campaigning and sort of discussion of the efficacy of the downtown safety plan and the gains that have been made in large part due to the creation of the BRAT team. The BRAT team works with a number of these organizations, as they've attested to tonight. So in terms of, I think we might want to interrogate this phrase mandated charity, a donate, sort of setting aside the budget, a portion of the budget is, the human services is mandated charity. I would actually challenge that framing and ask people to consider that many of these organizations are fundamental to the work that is actually being done at a level that I would think that most people would agree is beneficial to the entire town and would probably not be considered charity in a sense. So for the question, and thank you again to the Human Services Committee for all the work that you do. I think it might be helpful to hear a little bit more about the vetting process. I know that we've had, something like 16,000 or not 16,000, like 1,400 pages of applications that you had to go through, and certainly a great deal of deliberation and care going into the allocation of those funds. Is there any more that you might be able to talk about and shed light on that process that might be helpful for people who aren't familiar with it to hear tonight, to be assured that it is going to organizations in a way that is extremely thoughtful and precise?
Avery, would you be able to kind of give a summary of the rubric and what we go through?
Sure, yeah.
Now, you could give an hour dissertation on
Yeah,
that.
I was going to say that. I think we had so at the beginning, we send out, when we're asking for applications, we send something out that organizations and the public are always welcome, can come here and talk about the rubric and the process and things like that. And then we also come in from the select board. And as David mentioned, well before we knew they were going to cut anything. And so we came to the select board and answered questions in terms of the process there. And then we also did that at a forum with a lot of the organizations that are here now. So I've babbled on about this a lot, but we're very excited about the process because there's a pretty extensive rubric. We ask questions that fall into categories, and I wasn't prepared to do this, sorry. Categories, basically we talk about kind of how much work you, the kind of work you do, why that's a vital human service if you feel it is, how does that specifically serve Brattleboro itself? And we ask for hard numbers of that. So some organizations in the past, we've been falling into issues where they don't collect those numbers. And we've unfortunately not funded them or even funded them at low amounts because they weren't showing their work, even though we did believe they did that work. So we've been pretty rigorous in trying to find even compromises between where people are in the spectrums of fiscal conservancy, versus wanting to spend a lot, things like that. We really are trying to balance that within the committee. So we look at those numbers and how many people they serve, the amount of money that they spend per service. We look at how many people they serve overall, and the percentage of those folks being Brattleboro residents. We look at that as well. Sometimes we've reduced amounts that people asked for based on how much they're spending per resident. There's some other,
I think that's just what we do.
Yeah, I could give
so
you
we run through the application and there's a good cross section of what we're looking at. And so, yes, the applications are tedious, laborious. There's a lot of information you're providing, but might be nice for you to know who you're filling that out. That in fact, through the rubric, we've revised it over time, so that truly information that you provide us is filling in the blanks, so we're cheating on the test and we're getting all the answers, but the information you're providing us is very helpful.
And there are two more categories. Sorry, one is if you serve the most vulnerable folks here, and how much you do that, and if you can speak to how you do that, because that's also relevant to us. And then collaboration, which I can't believe I forgot because that's what we're doing right now. It's really cool to see who lists who as a collaborator, and then organizations that we don't even maybe know about, and whether you're listing them twice. And then it also is a kind of glaring thing to us when someone doesn't name some of the organizations that are working in the same space. So we look at, for example, if you provide food services, are you providing that in a duplicate of what others are doing? Or are you working together and saying, Tuesdays they can come here, Thursdays they can come here, even if that here isn't in Putney maybe? Or how are they accommodating if they don't have a location directly in Brattleboro? We also try to make sure you're working really in Brattleboro. So it's a pretty rigorous process. And I think you can kind of disagree or not with whether we should fund at all, but I think if you really dig into this process and you look at the applications and things, I think it's pretty hard to find a way that this is actually not the way we should be doing it. I think to get in to analyze folks, So invite anyone to talk more to any of us or email us if you have real questions about that.
Can I just piggyback on what you're saying here?
Please do. Yeah, I was hoping some people on Zoom would jump in because we're.
Yeah, I just wanted to, because I'm on Zoom, I can Google stuff while everyone else is talking. I just wanted to read the categories that are on our scoring rubric that we use in evaluating these, because I think that there's some misconceptions when folks don't attend the process that we're doing around these things, like that some of these orgs are not like as essential as others. So I'm just going to read, these are the things that we score the applications on, and then based on the total score that they get is how we decide which orgs to grant funding to and how much of their request we're going to grant, whether it's all or partial funding or level funding it from what they got in the previous year. So the categories are they directly serving Brattleboro residents? Demonstrating a need for these human services in Brattleboro, the extent that the applicant provides human services, like are they serving a reasonable number of people based on their size and scope? Are they providing free or reduced cost? That's what the extent is talking about. The uniqueness of the contribution, that's kind of going to like what Avery was saying about like, or if they're overlapping with another org that provides similar services, are they working, in a collaborative way or just like doing the same thing at the same time? Participation in the Brattleboro service ecosystem. So this is where we look at what orgs they named as collaborators with them and how do these collaborations benefit their recipients. Accessibly centering those who are underserved or most in need. And this also is talking about like, is there a representation from who they're serving in the org? Is there a low barrier to the services? Is there demonstrated outreach? The demonstrated fiscal need and use of funds for these services, and the demonstrated fiscal solvency and fund management. So the last two ones are the ones where we're really diving deep into their budget documents and talking about how how they're how that supports the needs that they wrote about in the narrative part of the application. So that's basically how we are all vetting it, and then each person, after we've all discussed every application, individually scores each org on this rubric, and then we aggregate all the scores and then figure out how to translate that to whether we're going to grant the full amount of the request or a partial amount or not fund.
So if anybody needs some nighttime help, the application and all of our documents are online.
I think it's very
so
exciting.
You can. We make all that available. Are there any more questions? We do have a video we want to run as kind of a ending scenario. Any?
We do have a hand raised.
Okay.
If someone's spoken.
Oh, yes, I wasn't sure because my audio was not muted, so it didn't say anything about me unmuting. I just want to say that, first of all, I have very publicly committed to being the first person, if no one beats me to it, to stand up at town meeting and advocate and move for the human services budget to be returned to the 2% that we recommended last year. Second of all, I have spent over 30 years in computer security and privacy as a specialty. And so I am no stranger to the handling of sensitive and private information. But the fact of the matter is that this is public money and this is a public process. And the idea that people have to show up to the meetings in real time in order to have some more information about who is applying, why they are applying, and how much they are asking for is not a satisfactory answer. These matters must be a matter of the public record as a matter of transparency and accountability. Now, I understand that there may be some sensitive information in these applications, and that information should be redacted from what is available to the public, or it should not be part of the applications in the first place. But it is not acceptable to me to say that I cannot go to the town website and find out exactly who applied, how much they're applying for, and what they plan to do with that money. That is the most basic amount of information that the public is entitled to know about this process. Thank you.
And I will say you can see who applied, how much they're asking for, and what they want to do with the money. You just can't see all the details of exact numbers. But you can see the numbers of people served too. Like that's all, and it's included in that. But I think the point here is though that you're raising a valid point about we really should be able to discuss this process, and we might disagree about which information should be included, what should be asked for, and I think that is something there's definitely space for. So I really do appreciate you bringing that opinion and that thought, and it's something we can figure out.
My question though is, where is that information? I'm not asking for this information so that the public can second guess the work of the Human Services Committee.
Oh, no.
That's not my point.
And Jim, I appreciate very much what you're saying, and I will speak to town council certainly about that. And if directed to do so, we will correct that.
Thanks.
You can see the information about the what orgs are applying and how much each one asked for and how much each one was recommended. If you go on the page that you mentioned of the Human Services, there's a tab for current allocation spreadsheet. So that has all the numbers of like who asked for how much and how much they were recommended for. The part where it tells about each org and what they're asking for funding for, I think is in the report letter. Is that, it's usually in the town report. Is that posted online somewhere right now?
No, so you're talking about the introductory paragraph to the application?
Yeah.
In fact, I'm not sure if that's being included in the report this year.
Oh, right, because they recommend 0. So usually in the town report, there are pages and pages about these organizations. Everyone has submitted a paragraph that like summarizes their application, and it's in that town report. So yeah, I actually don't know that.
Yeah, no, I did ask the question, and a couple weeks ago it hadn't been decided. I honestly don't know whether or not those paragraphs are being included in the town report this year.
Well, maybe that's something we could just pass out photocopies of at the meeting, like how people sometimes do. If there's stuff that is not in the actual report, we could just disseminate that on our own.
That's something we can talk about too. Yeah. Okay. Anything else? So why don't is our final point. So we, as I said, Akil Shrivastava provided a video. It's about 6 minutes. And in talking with individuals, maybe we'll see.
Yeah, it's no longer in the documents, but I think I can find it next time. So, you're not.
Was it the last page on the?
You can see it. I would say talk amongst yourselves, but we may lose you forever. So. I'm just going to share my
I feel very strongly about that human services should be funded in Brattleboro.
I think it's a big mistake. I think that it is a really good investment for our town to invest in these human services proactively versus to deal with the fallout when people aren't having their needs met, which is actually quite expensive.
But all of these things like SEVCA, where they're trying to work with marginalized or at risk or people in abuse situations, or basically any of that is really important because it keeps people from going into crises. And that's the sort of thing that ends up costing the taxpayer way more over the long run than any of the 2%.
I see social services as preventative medicine for social well-being. If we want to, for example, reduce crime in Brattleboro, then making sure that we have strong social service organizations feeds the well-being of our community and also the morale and cohesion of our community so that people aren't as isolated, might have support going through whatever social or familial stress they're going through that might help them not get into states that are more desperate. There's just so many things that the organizations do.
I do feel that not investing in these preventative services can end up costing the town a lot more. In my case, I had to rely on the Women's Freedom Center in order to find safety for my child and I. And one thing that they did was they gave me tools to be able to escape my situation without becoming a statistic.
In our particular memory cafe, we really wanted a place where we could all meet together and do things together and just enjoy camaraderie. That there aren't really many places where, as a caregiver and the person with Alzheimer's, we can go where you just feel like you're appreciated and people understand what you're going through.
Like overall, I use them for so much. They gave me a bookkeeper, and like they've given me like access to like tax stuff and like so many things. So for starting a business, it's fantastic because like a lot of the stuff I don't know or I don't have the time to deal with. So like that's great. And then on top of it, to have like I've been working with their emergency housing thing for some other stuff that's been happening, and like they offer so many great services. So any cut like that would be frustrating.
I'm a big one on community building, and my past work was with the Vermont Everyone Eats program, which was all about, getting restaurants to work together to feed people in Vermont. And it was a transformative moment in my life. It really gave me the opportunity to learn a way to build community in an economic development setting. And then have that translate to other things, other ways to do it. It's not just restaurants now, it's all kinds of businesses. And no two are the same. It's pretty rewarding.
It's a disease where people will come and stay, and sometimes they can't stay anymore, and it progresses. It's a kind of a situation where people can have cancer, and maybe they can get some treatments or things, but Alzheimer's is not that way, and the Alzheimer's patients are in a constant battle of having their world taken away. And this is a situation where we can go to a place where we can be accepted and we can get together with other people, and we all know where we're at, and we all know we're in different stages, and that's the way the world goes.
There is absolutely no chance whatsoever that I would be here. I needed the Women's Freedom Center to get my family safe. I needed Winston Prouty. They were a place where I was able to do exchanges during my child's visits after I had to file for relief from abuse. And they were there to keep us safe during those times. And they also provided us with child care subsidy, which allowed me to get a job. So without that, I absolutely could not have worked.
And there's a lot of really dedicated, loving, smart, brilliant, determined, hardworking people here who are working together to make this town have an incredible quality of life. And a lot of that, I'd say the majority of that comes through the collective initiatives that people do. The arts collectives, the event programming, the downtown programming, the educational opportunities, the programming for kids and youth, and then also the programming and care for people who are in recovery, who need help getting back on their feet after suffering a loss or going through a really hard time. This community is very caring. It's been this way for generations, and I think it will be joyful, and we can afford to reclaim that identity and celebrate it.
So that is our evening program. Thank you all very much. Thank you for the organizations that presented. Thank you for the residents, people that came and took your time to participate, listen, and to offer your suggestions. Thank you.